Hi, everyone. I'm Ben Gonzalez, and this is TDI. Well, open enrollment for Medicare is starting, and that's not a program that TDI regulates. It's a federal program, but we wanted to point you in the right direction for information. So joining us today is Alice Navarro. She's with the Area Agency on Aging for the Capital Area. She's the lead benefits coordinator. Thanks for being here today, Alice.
Thanks for having me, Ben.
We appreciate you taking some time for us. So, Medicare open enrollment period is getting started. What happens during this time and what's important to remember?
So, Medicare open enrollment runs every year from October 15th through December 7th. This is the time when all people with Medicare can change their Medicare health plans and prescription drug coverage for the following year to better meet their needs.
And it's something they have to do every year, correct?
Yes, that is correct.
Yeah, I remember
It's important.
Oh, I'm sorry. I was just saying, I remember my mom was always trying to figure this out every year and would have questions about it. And so I guess there's some confusion about some of the terms like Medicare versus Medicare Advantage and the A's and the B's. Can you tell us a little bit about some of those terms?
Sure. Medicare has many different components to it. All Medicare plans are composed of Part A, which is your hospital benefits, and Part B, which are your medical or doctor benefits. You do have a choice between going with original Medicare, which means that red, white, and blue card is actually your insurance card, or with a Part C Medicare Advantage plan. I want you to think of a Medicare Advantage plan as a private insurance plan, such as a plan from Humana or United Healthcare that has been approved by Medicare to provide all of your Part A and Part B benefits. Medicare Advantage plans operate using a network of doctors such as a PPO or an HMO. Now, Part D represents drug benefits. If you take prescriptions, you should consider adding prescription benefits to your Medicare insurance, regardless if it's original Medicare or a Medicare Advantage plan. Sometimes you can find a Medicare Advantage plan that already includes those Part D drug benefits for you. Now, I do want to talk about another type of Medicare insurance that people are interested in, and it's called Medigap. Medigap pays for the out-of-pocket costs associated with original Medicare only. Medigap plans are sold by private insurance companies, and they are supplemental insurance plans. Now, sometimes Medicare Advantage plans are called supplemental insurance plans, and I want to encourage people to stop using that term supplemental when describing those Part C plans, because sometimes people think a Medicare Advantage plan and a Medigap plan are the same thing, but they're not.
So you need to separate those in your mind then.
Yes, for sure.
Well, one of the reasons we wanted to have you on and talk about this is because we've heard about scams that target older Texans, but are there things specifically to watch out for during this open enrollment period?
Absolutely. Unfortunately, there are many Medicare scams out there, and they seem to increase during the open enrollment period. So here are a couple scams for people to watch out for. First of all, anyone who claims to be an official Medicare agent. There's no such thing as a Medicare sales representative. Please hang up on any unsolicited phone calls trying to sell you a Medicare plan. Neither insurance companies nor insurance agents are permitted to make unsolicited Medicare-related calls. Now, it's the same thing for visitors to your home. This is not allowed per the Medicare rules. Unless you have made a contact with that person, that agent, or that company first, that's the only way that they can reach out to you. Now, never give information over the phone to somebody who says they need it so that you can keep your coverage. Hang up on anyone who asks for a quick payment, threatens you, or offers you free equipment or services in exchange for your Medicare information. That is fraud. Again, please remember that Medicare Advantage plans do not cover the out-of-pocket costs with your original Medicare coverage. They're private insurance plans that manage Medicare benefits. Now, another thing to remember is that you do not have to enroll in a Part D drug plan in order to keep your Medicare coverage. The Part D drug plans are voluntary and they have nothing to do with the rest of your Medicare coverage. However, if you do take prescription medications, it is a good idea to consider a Part D drug plan when you are first eligible for Medicare benefits.
So it's already sounding pretty complicated to me. There's lots of different moving parts here. I imagine this is the kind of stuff that you need to go over with people and during outreach events and such. But I guess probably the pandemic has complicated things this year, correct?
Yes, it has. COVID-19 has really made us rethink how we conduct education efforts with our consumers. But on the other hand, it's allowed us to be more creative in our approaches. We're also using virtual platforms this year, such as Zoom, to conduct presentations. But we can also use Zoom to conduct benefits counseling sessions with consumers as well.
Oh, that's great. So you're trying to be more flexible during this time, like we all are, like we're doing today. So, Alice, if people are looking for impartial information, is there someplace they can get that?
Yes, there is. They can actually reach out to their local area agency on aging. And the best way for them to find their local area agency on aging is to call 1-800-252-9240.
Is that number, we're going across the state here, so I know there's different area agencies on aging in different parts of the state. Does it matter where you are?
So this is actually a toll-free statewide number, and so it'll direct a consumer to the nearest agency that services their county, and so it'll require them to enter their zip code.
Okay, so be prepared to do that. Thanks, Alice. I know that we've only scratched the surface here, but maybe we've at least given people some ideas about where to ask questions. So if you have questions about Medicare or open enrollment during this time, you can contact your local area agency on aging at that number that Alice just mentioned, 1-800-252-9240. And if you have a question about another type of insurance, be sure to visit our website, which is tdi.texas.gov. Or if you want to call our helpline, that's 1-800-252-3439. So, for Alice Navarro, I'm Ben Gonzalez. This is TDI.